Now, it's that time of the year when medical aid scheme members can change their plan options. They get an opportunity to reconsider the requirements as well as the benefits. But terminology use can be quite confusing, and comparing options and schemes can be quite tricky. To help us make informed decisions, we've got Damian McHugh, who's from Momentum Health Solutions. Damian, thank you so much for joining us this morning. I was about to say this evening, my apologies. Anyway, Damian, let's talk about a gap cover versus a medical scheme. Now, when people are looking to get some kind of health insurance, they are looking for the cheapest options, but they're not always getting the best cover that they can. And people need to understand that gap cover isn't necessarily a comprehensive cover on your health.
Absolutely. In fact, gap cover shouldn't be used as a replacement for medical scheme cover at all. It's kind of like buying a trailer and then saying my trailer replaces my car. It's really not that at all. It's there to enhance your medical scheme cover, not to replace it. So it's an affordable insurance, which is there to top up if you're involved in if you're going into hospital, really. Gap cover is aimed at that. It's not aimed at replacing medical scheme cover at all. So yeah, don't use gap cover to replace medical scheme cover.
Right. And what are the benefits of having both? Should I be able to afford to have medical aid and then also take out a gap cover? What would the benefits of that be?
So what happens is medical schemes cover what we say at a medical aid rate. So let's just assume that costs 100 Rand. So you see a doctor, let's say, or a hospital, you're going to hospital and the cost of that's 100. Doctors can charge up to 3 or 4 or 5, and sometimes some specialties 6 times that price. So you go into hospital, your medical aid covers you at 100, but the bill comes to 500. And gap cover is there to help you with that difference. It's there designed specifically for hospitalization cover and enhancing your medical scheme cover to ensure that you've got a greater level of cover for those really high cost sort of hospitalization events. Gap cover doesn't help for doctor or a physiotherapist or anything like that. It's really there for in-hospital sort of insurance when the medical scheme coverage is lower than what the medical practitioners may charge.
Right. Let's move on to another important element here. Whenever we're looking to get medical aid or any kind of cover, we have to consider those with chronic illnesses and the fact that they have chronic medication that they have to take, and it doesn't come cheap, So talk us through that element of chronic medication, what's covered, what's not covered, really what can a consumer take into consideration here when looking for a suitable scheme?
So every medical scheme has to cover what we call the 26 prescribed minimum benefits and for chronic illnesses. So there's a lot of other prescribed minimum benefits, but there are 26 conditions which every medical scheme option, irrelevant of what option you purchase, must cover. It covers things like diabetes and blood pressure and hypertension and cholesterol and things like that. So the condition is what it covers. It doesn't necessarily cover the drug that you may use. So again, if I use a car example, the more expensive the car you buy or the more expensive the option you buy, the higher the price that the scheme will cover for that chronic condition. So you and I might buy a different option. We both have the same chronic condition, but one medical aid option might cover that chronic condition with a higher price of drug. And others will cover it. You'll still get cover for the condition, but maybe using a drug, a generic drug or something like that. So it's every condition, those 26 are covered across all medical scheme options. So you don't have to worry about, I may not have cover. You need to then worry about the level of cover. Some medical schemes give you a rand amount or a overall limit on some other chronic conditions as well. So check what your condition is. That's important. And does the option cover it? If it's not one of those 26, you can buy a more expensive option. Some options cover up to 60 chronic illnesses, and then you can make sure that you get the cover you require. So chronic is a really big value. What we also often find is people are chronic, but they don't register their illness. They don't contact their medical scheme and register their chronic, and then they actually use their savings accounts or their day-to-day values to pay for chronic medicine. That's a waste of their own money. The medical scheme would cover that for them.
Right. Now let's talk about getting a hospital plan and comprehensive cover. What is the difference between these and what do those costs look like, Damian?
Sure. So I think, again, it's based on your particular needs. So a hospital plan, by nature, covers hospitalization. And as I've just said, every medical scheme also covers chronic. So even if you're buying a hospital plan, you're also going to get chronic cover as part of that cover. A comprehensive plan will cover more than hospital and chronic. It will give you also a lot of day-to-day cover, and what we often call in medical scheme terms above threshold cover, which means when my savings account runs out and I've got no more savings left, there's a part which the medical scheme picks up again. And you get a bit of a hybrid that sits between those, a hospital plan with a savings account, but nothing that covers you above that savings account. So comprehensive plans are really by nature cover a lot more, hence the word comprehensive. Hospital, chronic, day-to-day, and that day-to-day includes savings as well as thresholds. Hospital cover generally, hospital and chronic only. There's no day-to-day cover. The price differential, depending on whether you're family or single, I'll just give you a broad level of pricing. A single member hospital plan can cost you, as little as 1,300 Rand, and that can, range to 2,800 Rand, depending on what other values in the plan. A comprehensive product, if you're a family, which generally comprehensive products are aimed for, can cost as much as 10 to 12,000 Rand. So there is quite a big price difference. Obviously, I'm not the 12,000 for a family that, the 1,300 example that I used is for singles. It depends on the option that you buy and obviously how big your family is. So just check what your family's needs are. What we also find is, sometimes it's the dad, the dad doesn't have all of the knowledge that he should have, and he thinks, oh, good, I'm healthy, but he forgets that his child or his wife may need other value. Make sure that you're buying the option that meets the needs of your whole family. Don't waste your money. Don't buy something that you don't need, but at the same time, also don't overinsure. That's the overinsurance, and don't underinsure, obviously. Don't buy something that you actually need a lot more cover for, because you're going to be frustrated with your option during the course of the year.
And a final thought from you, we also speak about co-payments when we talk about schemes, and why are these important?
Look, I think the co-payments are used to try and keep price down. It's the same as if you were having household insurance or car insurance. You have a co-payment or an excess, and that excess is, if I have an accident, I pay the first 5,000 Rand myself, and as a result of that, my premiums are cheaper. Medical schemes use a similar thinking. In order to try and keep premiums lower, there are some co-payments that are imposed on certain procedures. Generally speaking, those procedures are listed in your communication, so know what they are. So like a hip replacement or a colonoscopy, some of those things will carry what we call co-payments. They're there to try and keep price of the overall medical scheme lower, and then you're required to pay that upfront. Some gap covers, we spoke about that a little bit earlier, may even cover those co-payments, depending on the nature of the gap products.